This podcast series is made possible thanks to the generous support of the Patient Care Foundation. The Patient Care Foundation supports medical students in need through scholarships. Each year, the Patient Care Foundation changes lives forever by giving deserving medical students facing incredible odds funds to continue their education, resources as they deal with food, housing, and transportation insecurities, or other challenges in the wake of COVID-19. Thanks to Dr. Troy Elander, Chairman of the Patient Care Foundation Board, and Elizabeth Kurihara, Board Member. Welcome to this edition of Clear as Mud, the podcast dedicated to bringing clarity to medicine. I'm your host for this episode, Gustavo Friedrichsen.
We have three distinguished guests with us today. In fact, this episode, which is our seventh installment, is a first. And then we have two distinguished physician leaders, one who's having technical difficulties now, Dr. Omer Deen, our president-elect, but Dr. Hector Flores, LACMA board members on the call with us. And with us is our guest, California Medical Association CEO Dustin Corcoran, who just concluded our first town hall on universal healthcare expansion in California. Welcome, the two of you, to Clear as Mud.
And I believe we have Dr. Deen on as well now.
So Dr. Deen has joined us. So Dr. Deen, welcome to your first Clear as Mud episode. You'll be president in 6 months, but welcome to the program.
Thank you. Appreciate it.
So let's get right into it. Dustin, Hector, Omer, thanks for being on the program. Omer, do you want to kick off any questions for Dustin that you didn't have a chance to ask? And then we'll have a quick discussion as we wrap this up in 10 minutes or less for our audience.
Well, again, I just want to thank Dustin for your efforts here, for going through all of this and kind of laying the framework. This is a complex, multifaceted topic, and I think you're in a unique situation as CMA president because you have members from all over, right? You have employed members and private practice members and retired members, and you're probably hearing a lot about the good old days and how things used to be and the problem with the current state of medicine. So I'm very familiar with that. I get a lot of that, and I'm sure you get that tenfold. But I think one of the issues that we often don't realize is kind of, in practice, we all have our experience with our patients and our payers and what drives us in the day-to-day, and we get wrapped up in that. But when you step back at kind of a bird's eye view and you take a look at kind of the multi-payer system we have currently and how physicians end up in a position where they're having to pick and choose which insurance plans and payers they're going to accept and not accept, what that ultimately does is it denies patients access. So somebody could live within 2 minutes of where I practice, for example, and be unable to see me based on my biller or back office often their decisions on what payers can or can't be seen here and what will or won't work. And then that then drives patients to these pools particularly in underserved areas, but certainly not exclusively, where you are now seeing a smaller proportion of providers who are overburdened, who are seeing patients much faster, who are not able to address all their areas that need to be addressed. And so it's this whole vicious cycle, because when you're getting that kind of haphazard, care, I hate to say suboptimal, but really it is, then you end up with more emergencies and you end up with greater healthcare expenditure in emergencies, right? So we look at expense, we talk about healthcare dollars and how much we're spending versus other countries, but it's all kind of driven within this system, Any comments on that?
Yeah, well, I think a lot of what you said is entirely accurate. And frankly, we saw it play out in sharp relief during this pandemic. One of the things that I think we're going to have to do as we come out of the emergency part of the pandemic, and we're still dealing with obviously all the waves and the variants and whatnot, but as we come out, is reflecting back on our ability to be able to care for Californians during a really critical time. And those inequities were laid bare too often and in a very raw way. I think coming back and doing a lot of critical analysis on that, of what went wrong in that moment, that we weren't able to meet some very basic needs for significant portions of California, rural California, many parts of the Central Valley, urban areas in California that didn't have access to some of those early services, whether it was testing or ultimately vaccinations. And our failure to be able to deliver on that requires a honest and critical look so that we can shore up things like the Medi-Cal system and make sure that there's a robust provider network for every Californian, irrespective of the money that they make or the program that they're in. Look at the ability to be able to leverage entities like the Department of Healthcare Services and their administration of Medi-Cal, covered California, CalPERS, and other private payers to really form robust networks, well-funded network of providers in every single community, not just those communities that are well off. And I think any honest look at the last couple of years will show that we haven't met that moment at all.
Thank you, Dustin. And, kind of a follow-up to that is the CMA has historically set up a lot of services and initiatives that benefit all physicians, not just members, but all physicians. The ultimate goal is to serve Californians better. Could you describe some of the programs that the CMA has initiated recently? The big challenge for doctors across the state is practice transformation, implementation of technology, redoing their workflows. We talk about the new normal with COVID, telehealth and telemedicine and bridging that digital divide with our patients. Could you describe a little bit more about the services that CMA envisions?
Well, we certainly do a lot, and we try and advocate for all physicians in the state. And that was brought up earlier. Every mode of practice, every specialty is represented within the California Medical Association and our County Medical Association partners. And you take some of those programs. Thank goodness we did some of them out ahead of the pandemic, but much more is needed. I had the pleasure and honor of serving as co-chair of Proposition 56, the tobacco tax that increased tobacco taxes by $2 per pack. The net result of that was the most significant investment in Medi-Cal reimbursement rates for physicians in a generation. Now it's stunning that we had to go out and we had to help fund that with our partners at SCIU and Tom Steyer, who contributed mightily to that effort. That was the first significant investment in the Medi-Cal program on the provider reimbursement side in a generation. And we got to let that sink in about what that means, how underinvested we are right now in the Medi-Cal system, particularly when one out of every 3 Californians is now covered under Medi-Cal. 1 out of every 2 new births is in the Medi-Cal program. The state has done a fantastic job, and it should be applauded. And this administration should be applauded for its expansion of Medi-Cal coverage to undocumented communities that had been left behind under some of the Affordable Care Act expansions. But we need now to invest also in access and make sure that people can see a physician, can get to a clinic and get the care that they need, not have it based on where you live or how much money you make. And we haven't done that job as a state. We have an opportunity to do that coming up, a anticipated $31 billion surplus that the state will be looking to spend. And I can't imagine what we need more evidence to demonstrate the need for an investment out of that $31 billion in the 2 years that we just went through, the inequities that were laid bare by COVID that were highlighted in too sharp a relief. We need to invest in providers in those communities so that they can stay in practice because they're under financial duress from COVID as well. In addition to that, you touched on a couple other items. I do want to talk about telehealth. That was a big lifesaver for patients, for providers. To move into that environment was meaningful. We were able to get an early commitment from the governor, who executed an executive order to require parity in payment for telehealth services for all physicians. So during the pandemic, we were able then to subsequently pass legislation to expand that parity in payment. That was signed into law, and we need to make sure that that's effectively implemented. And what we really want to see there again is the ability for physicians to be able to communicate with their patients, not have patients rerouted to physicians that are out of state or some big corporate entity that has no meaningful engagement or relationship with that patient, but a personal physician, a personal provider that person's familiar with, being able to communicate by video or by telephone, get the care that they need. And importantly, if they need to come in and be seen in person, that they're coming in to see the same provider that was able to assist them over a telephonic or video mechanism. But that parity in payment was a huge victory that CMA was able to get across the finish line during the pandemic and now permanently ensconced in California law.
Gentlemen, I have a question, Dustin, regarding the Aledade and Alteus relationships. Those are 2 powerful relationships, and we've been trying to share what those relationships mean for providers here locally. Can you just sort of give a 30-second sort of, if you can't even do that right now, sort of like description of those 2 powerful partnerships?
Yeah, they're both based on the same premise. And again, that's trying to get the back-end services to physicians to allow them to practice in value-based payment arrangements, be able to get into more complex payment arrangements that it's going to be better suited for their practice, better suited for their patient population, and not just have it available to larger entities. We want to be able to support physicians in every mode of practice. We want to be able to support physicians in every part of the state. And we know we have big parts of the state where there aren't large medical groups that are there that are available for physicians to practice in. We need to be able to support them. And in underserved communities, the same is necessary as well. We need to have diversity in the practice of medicine. Ultimately, that's good for all physicians, that there's not only one choice about the mode of practice that might be available to you. And so in both those partnerships with Aledade, which does Medicare shared savings, that's their focal point. Now they're looking to expand beyond that, but helping physicians take that first step into a value-based payment arrangement without having downside risk for the practice itself. That's what Aledade helps practices do through our physician service organization run by Sarah Summer, who's doing a fantastic job. We're able to help physicians get into that and make sure that they share in the savings that they generate for the Medicare system. And we returned an incredible amount of savings that physicians here in the state of California were able to get the upside benefit of. Good for Medicare, good for the physician, good for the patients they serve. Similarly, Alteus is moving into the more on the commercial side, but with the same goal, which is to bring a suite of services to physicians so they can practice the type of medicine they want to practice. They're freed up to spend more time with patients, not doing a lot of that back office work, but having high-end services that are available to them, no matter the mode of practice, whether you're in a medical group or whether you're a solo practitioner here in the state, able to practice what I think is going to be the future for physicians and for patients. And that's a value-based payment arrangement where the physician and the patient interests are aligned, and better for payers, better for providers, and ultimately, most importantly, better for patients. Those two partnerships are really powerful for California. We're walking the walk, not just talking about it up here in Sacramento as an obscure policy thing, but putting our efforts and our energy behind market-based solutions as well.
Great. Thank you for that, Dustin. Dr. Flores, Dr. Deen, any other questions of Dustin Corcoran?
No, nothing for right now, except that, Dustin, I know you're busy, but I'd love to have your participation in our future sessions coming up in upcoming months also. I think your input is invaluable, and it was great to hear everything you had to say today as well.
Thank you for having me, and glad to be your guinea pig.
That's right. You know, on the subject of value-based practice, right, performance, you said it really well, and and I agree with it. Spending more time with the patient, like your own dad, but it does beg the question that if we're spending more time with fewer patients, who sees the rest that need to be seen, right? Mm-hmm. And in our practice transformation, we include PAs and nurse practitioners, mm-hmm. and we have the collaborative practice model. They become the extenders, literally, of our ability to serve the patients that need access to us. But now there's the scope of practice debate, right? Where nurse practitioners are saying, well, there's solo docs that can't afford to hire a nurse practitioner or don't want to, but the need is there in that community, and we're going to be there to meet it. What is that sort of happy medium in response to that?
I think you articulated it. It's a team-based practice environment. We get into this binary debate on scope of practice sometimes, unfortunately, where it's an either or, and it becomes a replacement for a physician instead of, as you said, an extension of the physician of the group and the ability to be able to practice. I think out in the community, in many practices, it's almost a false debate, because that's not how practices are organized and the way that they're typically run and operated. So, we need to help promote team-based practice environments. We need to think about expansion of access. We need to think about the ability in a value-based payment arrangement to be able to have appropriate levels of care. Nothing should ever supersede the expertise and the education and training of physicians, their ability to be able to diagnose and to be able to treat at that high level. But that doesn't mean that there's not an appropriate role, an appropriate place for providers of all levels, whether it's NPs, PAs, MAs, and the like. So again, I think when we get into these binary debates, we make it a false choice. It's a debate that happens here in Sacramento, often in the absence of real world situations. And we have a lot of organizations that are part of CMA where we can learn, then put into practice how this can be done in the best way possible. Some of our large organizations that have been doing team-based medicine for a very long time, whether that's Permanente, University of California, and others that have successfully implemented team-based arrangements, and distill that down. How do we extend that into smaller practices that are in rural environments, in urban environments, and make sure that it's done appropriately there as well. But we can take a lot of those lessons learned and distill them down, get rid of some of the noise and angst up here in Sacramento, and bring it down into the community level.
Dustin, I appreciate that. Thank you, Hector, for asking the question. Well, many thanks to our sponsor, the Patient Care Foundation, for their generosity, and our production team of Gabe Zuniga and Danis Chung. Thank you to Noemi and Lisa on our LACMA team for coordinating the podcast. And most of all, thank you, Dustin. Thank you, Hector. Thank you, Omer, for leading the effort to generate real dialogue on this topic. On behalf of our 7,000 members, as we just celebrated our 150th year, thank you, our members, our listeners. Check out our Monday RX, and of course, download the Clear as Mud podcast and share with your colleagues. And with that, I'll just say thanks for listening to Clear as Mud. Be safe and happy holidays. Thanks again, Dustin, Omer, and Hector.
Happy holidays. Thank you.